All right, well, welcome everybody to our another lecture series here at Pray Health and Wellness. We're excited to dive into another fun topic. And so tonight we are featuring our incredible chiropractors, Dr. Kaileigh McLaughlin and Dr. Christina Redding. And we just are, or Chrissy as well. We are excited to just hear them go into this topic of prenatal, pediatric, and family wellness chiropractic. As being a family nurse practitioner over in our other building, we get to see a lot of interactions with our chiropractors that I think most people don't get to see in the primary care setting. And to see the value that they provide from all generations in their care with my patients has been, I think, just life-changing to see that. And to have patients comment that they recognize that like our chiropractors are different. They come alongside us in our functional practice and perform, functional chiropractic care, which is pretty unheard of and is really special that we get to work alongside them. So I'm going to turn it over to them and excited to hear from them this evening.
Thank you. Thank you. What's whatever. Do you need to see this though? Okay. I bet I can do this. Well, thank you. Like she said, I'm Dr. Chrissi Redding, and this is Dr. Kaileigh, and we're going to talk a little bit about chiropractic. Chiropractic is a form of bodywork that includes gentle and specific adjustments to any joints of the body. Generally, most people think spine when they think chiropractic, but we can adjust cranials and we can adjust any joint in the body, ears, lots of cool things. So it's definitely not just spine related. We usually take full case histories at our initial visits when we see somebody new. We might do like a combo of neurological testing or orthopedic testing. We definitely palpate to figure out where there's pain or dysfunction, lack of range of motion or restrictions. A restriction found in the spine or cranium can put kind of a tone pressure on the nerve that creates nervous system miscommunication. I like the analogy of like stepping on a hose, like when the water's coming out, you still might have a little bit of water coming through, but we open that joint and get that nerve or the water flowing to where, the brain and the spine can communicate better. After we find what we find, the restrictions, we will put like a very gentle and specific adjustment into the area where there's joint restriction. And that really helps flow, like I said, the brain and the body, the nervous system talking. Sometimes if there's soft tissue work, we will also do soft tissue like trigger point therapy or some gentle stretching. A lot of patients want to know how we perform these adjustments. So there's a couple techniques we like to use here at Prairie Health. We have an instrument assisted adjusting tool. It's activator methods. And then we also have the manual adjusting. Both of these techniques do the same thing with the same goal in mind. They put restore movement where there are restrictions. There's just a little bit of difference in how that is achieved. So as chiropractors, we care about the whole body. So we often will help you like kind of make some home exercises, nutritional advice, some stretches, and then we also can refer to the PCP if we need to. So there's lots of different things that chiropractic can work. Oh, so here we're talking about one of the cool things about Prairie Health and Wellness, and Kaileigh kind of mentioned this, is that we have direct contact with your primary care provider here at Prairie Health, so we can like send them a message like pretty instantly. They'll get it, and we can kind of talk at our meetings and things like that, and really help each other solve what's going on with the patient. Here at the Movement Center, we have lots of different things: personal training. We have Julie that does MNRI, massage therapy, assisted stretch, and Ian that does MAT. So we all work together, our body workers, to kind of work with the overall health of the patient. So I'll turn it to Kaileigh here, talk a little bit more about the specifics.
Yeah. So obviously, the circle of life, like we start in utero and we go and we grow up, at least as women, some of us become mothers, and it's the circle of life. So, I like to kind of start in reverse and start talking about prenatal care because that makes a huge impact on baby and mom both. So prenatal chiropractic has a really long-standing history. It was really the first documented research that started happening was by Dr. Larry Webster in the 1970s. He had been treating a lot of pregnant women with a lot of great success with smoother labor and deliveries, more comfortable pregnancies. But it was really him helping his daughter through pregnancy, making her more comfortable, that he started doing his research. Through years of his research, it has been shown and data has shown that women report more comfortable pregnancies during labors and deliveries. There's less interventions, there's less hiccups, less complications, less mortality rates, less intrauterine constriction, all of the things. So, I always like to specify if you start Googling Webster technique or reading mommy blogs or praise reports from this technique, it is often miscommunicated that our chiropractor spun our baby around. So if baby's in breech position or transverse position, that we spin them. And that's not what we do. We don't practice obstetrics. So I like this is something that I'm really passionate about, to keep our names in the clear as far as what we're doing. But ultimately, Webster technique helps balance the mom's body and nervous system and open her hips and pelvis so that baby has the greatest chance to get head down in optimal fetal positioning to allow proper positioning and smoother labors and deliveries. So we're not actually palpating the baby. We're not manually moving the baby around. We're just working with the mom's body. Um, So during prenatal adjustments, I guess I should go back to Webster technique a little bit. So Webster technique is a very specific analysis of the mom's hips and pelvis. Based off of the findings that we find there, we give very gentle and specific adjustments to that area. We also work all the soft tissue stabilizing structures around that as well, including gluteal musculature, hip flexors, sacrotuberous ligaments, round ligaments, pubic bones, all the things. That can help mom's body get into a better balance in order to get baby into better position and to get mom more comfortable. I always like to give the visual that if you have a mom's two ilium, side by side, and then a tailbone in the back, we know that the uterus doesn't just free float inside this cavity where the baby is. It's actually anchored by a ligament that connects from the back of the sacrum or the back of the uterus into the front of the sacrum. And then there's two ligaments that go from the sides of the uterus into the ilium called the broad ligament, and the round ligament is encased in there. So if you can imagine, if there's torque on a pelvic bone or if there's torque on the sacrum, that's going to pull and cause constraint of the uterus, which doesn't allow baby to free flow and just be free in utero. So during your prenatal adjustments with us, we do the Webster technique, we do the specific analysis, we provide very gentle adjustments to restore function in those areas. We do the soft tissue release that comes with that, which includes round ligaments, hip flexors, sacrotuberous ligament release, and any tight muscles. Dr. Chrissi and I are also very passionate about what you do between visits as pregnant women. So we often encourage specialty exercises or stretches and things to do to help your body stay balanced, stay in alignment, and stay moving so that way you feel comfortable. Yeah, I listed a few on our pod or on our PowerPoint of things that I find helpful. Spinning babies is one of those things, and also the Miles circuit, but there's a lot of individual things that we do as well. Um, what's next? Oh,
Okay.
so one of our kind of big questions that we get frequently asked is, well, how do pregnant women get adjusted when a lot of your adjustments are performed laying face down as their bellies are growing? And over here to our right, your guys' left, we have pregnancy pillows. They are pretty sturdy foam with holes cut out in the center. So once you start feeling the firmness of your uterus on our table, the vinyl of our table, we add a cushion, and then as the belly grows, we keep adding more and more cushions so moms can lay comfortably face down all through pregnancy. Um, yeah, if you want to.
We call this one the Green Giant or Shrek.
Mhm. Yes. Yes, that's exactly right. So while we treat moms throughout the whole pregnancy, it is really suggested that they start seeing us during care early in pregnancy. So that way, if there is chronic restriction happening or muscle imbalance, we can address those things sooner because once the baby really starts growing and belly starts changing and mom's center of gravity is forever changing, it's a little bit harder to undo some of those restriction and compensation patterns. So our recommended kind of frequency of treatment would be as often as you're going to see your OB or your midwife. If you have more things going on, we may want to see you more frequently. If you have less things going on, we may be able to back that off, but everyone's just completely individualized. So as far as once mom has the baby, we feel very comfortable working on moms as soon as they feel ready to be adjusted. While I have seen a lot of mamas that literally leave their birthing suite and come get adjusted, or they leave the hospital and they get adjusted on their way home. Like that would be my preference because I like getting adjusted and I think it helps so much. But ultimately, I leave it up to moms and say, intuitively, when you feel safe to leave your home with baby, to come to the office, to get work done, to have hands on you, like that is when I suggest getting your first postpartum adjustment, is just follow their intuition on that timing. We do generally follow the 6-week rule if you have a C-section of not manually adjusting the hips and pelvis until that 6-week mark. But we can also adjust the upper back, the neck, the cranium, whether you're seated or laying face up if you're not comfortable laying face down quite yet. Um, so, again, as chiropractors, we really love taking care of the whole body. So that's why we recommend exercises and stretches and at-home things, but we can also make proper referrals to craniosacral therapist, massage therapist, PT and OT, yeah, lactation consultants, functional medicine doctors, all the things. And so, yeah, that leads us right into pediatric chiropractic. So once the mom has the baby, we like to see the baby too.
Absolutely. Babies can get adjusted 10 minutes after they're born. I mean, mine were, but we don't expect them to come in 10 minutes after they're born. But they also have a spine. So the same process as traditional chiropractic care, they need body work too. If you think about restrictions just coming through the canal, even though it is a God designed process and very natural, they are going to have um,
A lot of force.
a force. Thank you. That's the word. Force put on them trying to get out of the canal. And it's always good to just get them checked. We also can help if they are struggling with nursing and turning their head side to side. That's a good indicator that they need an adjustment. They have a restriction. I feel like I jumped a lot, but yeah. Oh, and if baby wasn't like in optimal fetal position and things like that, they're going to probably come out a little wonky. So they're going to just easier to get them looked at. As sooner the better. So usually we like to check baby when mom comes in for that postnatal appointment. And our adjustments obviously look a little different for babies. We're not going to do much manual adjusting on a baby. It's about the pressure of a tomato, like if you're checking to see the ripeness of a tomato. So it's a lot more like gentle pressure with our fingertips and not like snap, crackle, popping, obviously. So
Twisting and turning.
no twisting and turning babies' necks and things like that. So that often surprises people when they're like, oh, babies can get adjusted? Absolutely. And it looks completely different than how we would adjust an adult. Another thing, if babies are having a hard time sleeping, they're colicky, things like that, those are really great things to get baby looked at. Their jaw, sinuses, maybe if they've got like flattening of different parts of their head, tilting like the torticollis, digestive issues like constipation. So I think I mentioned sleep struggles already. I'm sorry. Oral. Dr. Kaileigh is very, very passionate about like tongue ties and oral restrictions. So she really can help babies with breastfeeding. Yeah. Sorry, I thought you were pointing to something. Sorry. So, and then obviously once baby's thriving and doing great eating, just getting kind of checks every once in a while as they start doing milestones like rolling over, setting up, crawling, pulling to standing, walking, just those big neurological milestones is a great time to get baby looked at. And then during the first year of life and beyond, chiropractic care can be extremely beneficial to children. They grow super quick. have lots of falls, head hits, things like that. Getting baby in or child in is super helpful. When we think about the number of things we see children for, the list is never ending. We've got growing pains, rolled ankles, head hits that lead to neck pain, goose eggs, pain anywhere in the spine, constipation. One of Dr. Kaileigh's favorites is probably treating earaches and infections, headaches, sleep issues, congestion, coughs are just a few of the things that we can help with kiddos. As they grow mature, they learn more about their bodies, and they often, like my children, are very much like, Mom, I need an adjustment. And so they're very aware of how they feel and when they're ready for one. So you can just kind of play it by ear. It helps with like their balance, flexibility, things like that. So super helpful to get kiddos looked at, which leads us into the whole family. Usually we see mom, baby, kiddos, and then dad will trickle in. So,
Sometimes grandparents.
yes.
Yeah. So overall, as a family wellness chiropractor, or chiropractors, we feel really passionate about caring for the whole household. Where we have regulated nervous systems and bodies feeling really good, we have happier households and healthier households, and babies and kiddos thriving and moving well and growing well and just happy. Um, if you think about when you feel really stressed out, how that feels in your body, a chiropractic adjustment can just help blow that fire out and calm things down. And sometimes whole families need that. So taking care of families as a whole is just fun. I know as a chiropractor, some of my favorite things that I love working on is I really like working with mothers and babies who are having breastfeeding struggles. I have 4 kiddos of my own that have had unique journeys in the breastfeeding field. And so I've gained some experience, but I've also attended a lot of seminars to figure out what in the world was going on. And so I just feel passionate about helping moms with that. I also have training in neurosensory integration, which I always refer to our Julie for MNRI, but I really love co-treating children with anything neurosensory included to just, again, help regulate their nervous system. I know Dr. Chrissy loves to work on all family wellness things as well, and she loves babies. um, yeah, and that's all. So, does anyone have any thoughts or questions? Yes, Jolene.
Moms and babies have to be members of Prairie Health and Wellness to see you.
Okay, the question was, do moms and babies have to be members to see us? And that answer is no. Um, Early last year, our whole entire movement center opened up to being able to see non-members as well. So members and non-members.
Good question.
Do you do tandem appointments, like where you see mom and baby at the same time?
Yeah, the question was, do we do tandem appointments where we see mom and baby at the same time? And yes, absolutely. It's really actually pretty fascinating. I wish we could take some videos of it, but if baby is upset or uncomfortable or getting wiggly or squirmy and we start regulating mom and working on mom, baby starts melting too. It just goes to show how connected their nervous systems are. We like pairing their adjustments together because it's really difficult, especially early on when babies are first born, to have mom come out to one appointment and then get out of the house again for the baby. Like we just work them together. That way it's less trips out of the home and they're getting their nervous systems worked on together. So, yeah. Anything else? Okay. Well, thank you for coming this evening. We appreciate it.